Hello and welcome to the Western Health and Social Care Trust's DVD on revalidation for nurses and midwives. The Trust has made this DVD to share with the wider nursing and midwifery workforce the experiences of our staff as they journeyed through the NMC revalidation pilot. We are delighted to be able to say that the nurses and midwives who participated in the revalidation pilot project were successfully revalidated, although it was a mock revalidation. The final thing that I would say is that all nurses and midwives received from the NMC on the 1st of April this year a revised nursing and midwifery code. And the biggest bonus that comes with the revalidation and the introduction of the nursing and midwifery code on the 1st of April is that this code is very tightly and inextricably woven into the revalidation process that you and I will follow. And I don't think any of us would have any difficulty in appreciating that we have a requirement as nurses and midwives to be able to evidence that we are prioritising people, practising effectively, preserving safety, and promoting professionalism. In doing this, I have no doubt that as nurses have portfolios that demonstrate this standard of working, we will increase and enhance and build on the public reputation that the profession already has, and bringing a greater level of confidence within the wider public arena.
Hello Simone.
Hi Mary, how are you?
I'm good, how are you?
I'm great.
Good. I believe every registrant has to create an online account with the NMC. Would you be able to show me how to do that, please?
Yeah, that's not a problem.
Thank you.
If you just go to the NMC online,
Okay.
and it should take you to this page. There's a wee area here where you can register. It will ask you for an email address, so if you just type in your email address,
Yes.
and it asks you to confirm your email address. You just scroll down, accept the terms and conditions,
Okay.
and then you can register. I won't proceed with this because I already have an account with the
Your own?
NMC. Yeah. But it's just as simple as that. It can take 15 minutes for the email to come through,
Okay.
and then you just confirm the email and you have your account.
The organisation has already many processes in place which will assist the registrant to prepare for revalidation. An example to start with is clinical supervision. Clinical supervision can be used by the registrant when they attend 2 sessions per year. They bring an issue which they wish to reflect on. That issue can be discussed, and that issue can then be reflected upon and written up and produced as part of their portfolio. There are, for example, where a registrant could reflect on a clinical incident, they could reflect on an untoward event, they could reflect on a complaint, and use those reflections and write up those reflections again to build on their portfolio. So there are many opportunities in everyday practice for a registrant to reflect on. There are other opportunities which the Trust provides for a registrant to prepare for revalidation, such as mandatory training, non-mandatory training, self-directed learning, where a registrant can have the opportunity to avail of that, and all of those things will contribute to the continuous professional development of the registrant.
For me, revalidation initially, I have to say, because I was a new ward manager, I was just kind of fitting into that role or trying to fit into that role, so I had all the challenges around, a new ward manager and a new role. And then for me, revalidation coming along at that time was actually quite a scary prospect. Not only for me, because I was worried about my own revalidation, how I was going to prepare for it, but then on top of that, how was I going to ensure that 27 staff nurses were fit for revalidation? So yeah, it was a pretty scary prospect. So my first action plan really was to join the pilot. Initially I was looking around how do I communicate this to everyone. I decided to have a notice board in the tea room. Because it was one area within the ward that everyone gathers. If you were having your sandwich or your cup of coffee, the information was directly in front of you. The discussion around revalidation for the most part, took place in the tea room. But the knock-on effect of that was it was out there, everyone was discussing it, everybody was talking about it. I was then being asked questions, what is this revalidation? What do I have to do? So it kind of raised awareness, and that for me was a really key issue. And the girls actually took ownership of their own revalidation. And I have to say, a few of the girls on the units, their portfolios are excellent, and they probably do at this stage know more than I do about the revalidation process. After going through the pilot myself and actually looking at my team now as to where they were when we started, the values are actually quite surprising. One of the values is, the one that I kind of hold at the top of everything, is the staff are more empowered, they're more autonomous, they have gained knowledge through this whole process and they've been empowered by that knowledge. They've taken ownership of their own learning. They are now reflective practitioners, where some time before that they maybe weren't so sure about reflection. They were maybe doing it on a daily basis but weren't sure of the process. Now, through appraisal and through clinical supervision, they're much more reflective practitioners. That to me has huge benefits. It empowers the staff, it gives them that resilience. If they have an issue or they've had something that's going on within their day, they have the tools to reflect on that. They have the tools then when they're going into clinical supervision, to discuss that. And I feel now at the end of this journey within the unit, we're a stronger team. We're definitely, a better team.
As a bank nurse, I still get my training and I get anything that's updated, I'm told about it on the ward. So I feel that I had enough experience to be able to do the reflections. But after reading and going to all the meetings and all, I realised that reflection can be a small thing. It can be as little as a few paragraphs, or it can be as long as you like. It isn't academic writing, which a lot of nurses on the ward I think are frightened of, because they're looking back to their reflection and models of reflection at university and they're thinking, oh no, where am I going to have the time to do all this? But when we look at it realistic and it's further explained, it becomes quite clear that it's just relating to incidents that you do and experience every day with your patients on the ward, and you just think what happened that you felt just wasn't right or that you could improve upon. And I tried to write myself a wee list of thinking back of incidents that I felt strong about and that I could have made better, and then I narrowed it down to 5 that I felt I could write more about, and that's how I choose how to go about writing the reflection. The purpose of it is my experience as a nurse, to see what I can do better for patients and improve their safety and the best care for them. Looking back, an example, like I had a patient with asthma who came in really short of breath, and I know myself that asthma, if you do the proper care and you followed all your care plan and all, that he should never got that situation. So I decided to speak to him and ask him, did he know about peak flow and care plans and all. He didn't have a clue about them. So I felt patient education, I give him that, and I reflected on that because I felt that by me telling him that will help him in the future. And I feel that I'm a wee bit better in control of it because I've attended the pilot study. So I'm trying to help them, and because I've been through it, I'm explaining to them what I've learnt and pass it on to them. And I've showed them a couple of my reflections, and then when they seen that, they felt, oh, is that all it is? So they felt more able to do it.
You can get feedback from a variety of different sources. It can be from the patients, it can be from other colleagues, service users, the parents, people in education that I work with, and it could be positive or negative feedback. So when I started to look at some of the things that I had coming into me, I discovered, there was lots of things that I could do for feedback. So I looked at things, doctors' letters, where they said, I'm referring this child to see the nurse, Rhonda Riley. She provides an excellent service. So that was another good piece of feedback. I was able to look at things like audit, where I had comments from parents on the service provided, and I was able to take comments from that were both positive and negative, and reflect on those and see if they were, see if anything we could do with that feedback then to make a difference in the service. One particular instance was a parent commented that the literature that I provided in the the clinic was a bit too childish for their child who was a teenager. So I was able to reflect on that, and as a result of that, made a change to the literature provided to provide literature for younger children and for adolescents. And then that all linked back in then to the NMC code, where I was providing a good service and providing and meeting the needs of the parents and the children. Or whenever I was looking at the feedback, I did use it as a means of reflection. And as such, I used the NMC template for reflection. It's a nice, concise guide, and it sets it out really quite clearly. So I was able then to write down what the parent had commented, what my action was, how it was going to bring about a change in the service, and how that was going to improve the patient care and experience. The revalidation process requires that we adhere to the code. That's everything comes back to looking at the code. It's really important to pick up the 4 different key areas of the code and to relate that back to the reflection and to then improving the service. It's all about providing a good service for the patients that's safe and effective. I think that the revalidation process is an easy process to follow. I do think it's important that we do it over the 3 years and that you continue to do it as you go along. But it wasn't as time consuming as I at first thought it was going to be, and I think that every nurse has enough experience, knowledge and feedback there in order to revalidate successfully.
I've had the chance to carry out the role of a confirmer in the pilot in the Western Trust here, and I was able to confirm staff that were within my own area. So I was looking and able to discuss with them. What I wanted to confirm with them was that they had completed their hours of work. I wanted to confirm that they also had completed their CPD. So that was that they had to have done their 40 hours of learning, which was relevant to their own area of practice, of which 20 hours of that was participatory practice. I also wanted to see that they had carried out 5 pieces of reflective work and 5 areas of feedback that they had received. Now, what I didn't need to do was I wasn't signing off that they were of fit health character. That's something that they themselves are saying. Nor was I able to look at their practice before I knew them, or can I vouch for what their future practice is going to be. So that is not something that I was doing as a role of the confirmer. I had a certain straightforward, it was laid out for me what I had to do in my role as confirmer. So it's those key points.
Tell me, how are you all getting on with revalidation and the processes that you need to do?
Well, initially I think it was quite scary for us all, and
It's just a shift in culture. It's just something that we'd never done before. It was a fear of the unknown. But once people actually realised what they had to do and that they were already doing these things anyway, it was just putting them down formally. It became a lot easier and a lot more accepted.
The professional discussions have been key around where they have wrote their reflective pieces of work. So it was really around that as to what we teased out what was the professional issues for them, looked at where it related to their code, what specifically it meant for patient care, what it meant for their nursing teams, and we brought it back that way. So it was, and what practice they could improve if there were areas of impractice, or if it was really for them to be developing their own their behaviours. Maybe it was them needing to go off and identify training that they needed. So in one case, somebody needed more assertiveness training, when they felt that they had had a challenging experience from one of the SAIs. It was what they could do to be more assertive when they wanted to confront people. When I'm looking at the pieces of reflective writing, I'm not looking to see a page-long academic essay from somebody. I'm looking at short, snappy, that I can see what it is they're trying to say, they're trying to give an illustration of what the incident or scenario was. I'm looking to see that they are laying out the points, identifying it and linking it with their code, and that they are bringing into their own personal reflections as to how they have learned from it, what they can improve as a result of it, and where they can share that learning with colleagues. Having carried out the role of the confirmer in the pilot, what I would be suggesting for meeting with future colleagues to do confirming in the future, I would ask actually to see the portfolio sometime before I would have the meeting arranged. What I did in the pilot was the person came to me with their portfolio and I was seeing it for the first at that stage. It maybe made it more difficult for the person I was speaking to because they had to sit and wait while I was pondering through it. If I had had the portfolio beforehand, I could have thought through what I want to pose questions, where I want to dig deeper with this person, or where I want, to explore points. That was something I maybe thought more questions after they had left. And if I'd had the portfolio prior to the meeting, it may have been much more enriched experience for the individual. Being a confirmer wasn't as daunting an experience as I had anticipated it was going to be.
As a registrant myself, I was already fulfilling the requirements for PrEP. Revalidation is just really a remodelling of PrEP. There are some things that have changed and adapted on it. Previously we had to keep 35 hours of continuous professional development. We've gone up by 5 hours to 40 hours, but over a 3-year period that really isn't a big increase. We also have to document how many hours of practice that we have done, and there was a minimum requirement for PrEP. The minimum requirement now is 450 hours, but again, if you work that out over the 3 years, then it's not a big ask. The one thing that I will say that might be challenging is for those people that are dual registrants. Somebody that is maybe a midwife and also a registered nurse, and maybe have done the odd bank shift to keep their general training alive and well on the register. They will now have to demonstrate that they have 450 hours of both registrations. So they will have to have 450 hours of midwifery practice and 450 hours of nursing practice. The main thing that I will say is do not panic. It is not a paper exercise. It is what we are doing on a day-to-day basis, but bringing all that together in a portfolio. The key hints and tips that I would give, having completed the pilot project, are write your experiences down as soon as they happen, because experiences become blurred if you don't write them down. We're all busy, and you go home from a day's work, and I'm sure you reflect back on what you did well and what could have done better, or what such and such said to you, or oh, that lady I wasn't happy with, and whatever else. Don't keep it all in your head. Write it down the minute that you can. The next tip that I would give is get yourself registered online with the NMC as soon as possible. We've had notification out that is now up and running. So even before the revalidation begins, if you can have that part of the process done, then you're going to save yourself a lot of time whenever it actually goes live. Don't leave everything to the last minute. You have 3 years to complete your portfolio. They want to see evidence that you have progressed over those 3 years and that your learning hasn't been in the last 6 months leading up to the registration or the revalidation date. But be smart. You're doing the things every day. You have your clinical supervision, you have your appraisal, you're continuously learning on the ward from incidents, from feedbacks, from reflections. So it's being smart and using what is already there. This is our way of demonstrating to the public that we are safe and effective practitioners, that we are learning on a day-to-day basis, and that the learning, just because we're a qualified nurse, the learning does not stop, that the learning continues on.
You'll have heard from others in this DVD that revalidation is very doable. Doable within a short space of time. They did it and achieved great success. You have longer, but don't let that let you be complacent. Get prepared now and get moving and getting your evidence together. Use your work friends and your colleagues and us as managers in the trust to support you. We're here to support everyone. And remember, at the end of the day, it's for the benefit of your patients and your patient care, and also for the benefit of your practice and your development as a practitioner. So good luck to you all.